Hello, I am Dr. Narotam Dewan, a general and laparoscopic surgeon. And today I am going to talk about life beyond surgery, which I means just performing surgical procedures. I am giving this talk after listening a talk from our uh, Dr. Praveen Bhatia, who also spoke repeatedly on life beyond surgery. So here, I will say that there are two types of surgeons. One are surgeons like there were William Halsted, Theodore Cocker, and so many others who worked in primitive time with primitive facilities. And they invented and innovated and brought forth so many very useful surgical procedures, some of which are still being followed. And there are other types of surgeons who follow the various procedures already in practice in the world, and they follow it and perform it and they present it very successfully. They teach them very successfully, and they are considered as the topmost surgeons, and rightly so. But uh, there is under the journal, there is a million or a billion army of surgeons, and they all also can achieve the best destiny of being one of the best surgeons in their lives, produce the best results by just following some of the principles which will help them to become excellent surgeons beyond surgery. Means I am going to talk here about the principles which will help you to become a surgical practitioner, a surgeon with qualities, a very successful surgeon with very few complications, a successful leader in your own sight. Number one is calm temperament. So, a surgeon should always have a calm temperament. Like this phone is ringing now, and I am avoiding it, unknown number. So, anyhow, so it is said that a half filled pitcher makes more noise. Now, you do a practical thing. I am thinking and speaking. So, open your mouth. You will find that you are not able to think. Means if you keep your mouth constantly open, your thinking process will stop. So, okay, that conveys some message. But if we act with calm temperament, we will give the impression that our picture is full with confidence, knowledge, ability, and control. Your silence will speak. It will speak loud. People will obey what little you will say. Your mind will work at optimum level. You will be able to hear and process your own thoughts. That is, a surgeon should always have a calm temperament. Second, your capacity to work under pressure. When things get tough, the tough gets going. You know, it is life keeps on presenting us with unforeseen difficulties. And many times our resources fall short of what is needed. So then we should remember this, that as we should bring out our toughness and get going. So when things get tough, a surgeon should be able to get going. Number three, to be courageous. What is courage? When the situation present you with no assurance of success, the situation is dangerous and unpleasant. You should remain yourself, contain your fears, and take risks in the achievement of your goals. That is to be courageous. So, if I have to go at night and there are some scoundrels or dacoits or thieves and they have weapons with them, but I have to go, then means I have to go. That is the courage. So, against difficulties, against unforeseen difficulties. Number four, attention to details. This is very, very important. Everybody teaches us truthfulness and data. Data means details. So, keen observation, meticulous investigations, frequent reviewing of facts and developments, thoroughness, accuracy will make us achieve our task and avoid any negligence or pitfalls. Number five, focus. Focus is to put all our energies with concentration on the task at hand, giving our 100% without bothering about what is going around. Always focusing on your past successes and not focusing on your past failures. And to avoid all distractions frequently presented on the guise of attraction. So I always consider that many attractions are actually distractions. Number six is passion. Now you would have heard a long time follow your passion. But why? Because it will be out of your own liking, your love, your choosing. You will be able to put the best effort effortlessly, face difficulties without getting tired, without feeling pain, and you will not get discouraged when there will be lot of discouragement by people around. You will not tire and walk many extra miles if you work on your passion and do the things, do the surgery with passion. Number seven, active listening. Now you will benefit from my this talk if you intend to benefit by actively listening. So this will be if we listen to patients or staff or whatever lectures should be with eye contact and probing. We should think what is right, what is wrong, what is being said, and we should uh, have questions to explain the things. Even it is said if you meet somebody, the person said one's name, he is so and so, Mr. Albal Boja. So you don't understand. Please, sir, repeat. I haven't got your name. He'll say, I'm Al Bocha. You will listen it, then you will remember Al Bocha. Because many people have different names which are difficult to remember. So many things when you listen are not clear to you on the first instance. So please request that please explain, please repeat. That is active listening. And then summarize it. Number seven, resilience. Resilience beyond just knowing the surgical procedure is a very important quality for a surgeon. You should be strong enough to fight, tender enough to cry. You can make mistakes, but accept them. You should not let failure or pain overwhelm you. You should observe your pain and absorb it and bounce back to normalcy. That is resilience. Number nine, it is humility. We should recognize the power of others and should never think that we are better than others in every way. We should contain our ego, and that means that we should not think that all work and success is because of me. or my team alone. We should present ourselves by talk, walk, eye, and body language as benign persons. You should know that benign is the opposite of malignant. I need not explain more about humility. Number 10 is self motivation. We should work on our own foresight, initiative, and pursue goals and be creative. We should try to become what we want to become and not what others want us to become. That is being self motivated to choose your own path. 11. Delegation of duty. It is very easily said that everybody should delegate the duty. But what is delegation of duty? It is to grant the power to others to act on your own behalf. And you must identify the integrity and the ability of others, and then you must delegate your duties because you cannot alone do everything. Number 12 is empathy. Now we should put ourselves in other person's position and mind and try to fully understand the emotion and thoughts going on in the head of the other person. What is the perspective of the other person? What is the willingness of the other person? And the vision of other person? We should observe and listen so carefully as if we are inside the body and mind of the other person. So this will give a very good attachment uh, between the listener and the other person, and this will convey two-sided things, and the people will understand and they will be able to act together and work together, solve the problems together. 13. Cooperation. Remember, only those person will cooperate with you who will think that you will cooperate with them in future, or who will think that they will benefit from you in future. And also remember that out of the 100% relatives, friends, associates, staff, and other persons, only 15%, 15% of person will work for you to help you to achieve 90% of your goals. So, as a team leader, we have to create environment where we uh, the members work by mutual contribution to achieve a common goal, and we should identify those 15% who will help us in that team in our life to achieve 90% of our goals. Number 14, vision. So this is seeing, then there is sight, and there is vision. Vision is beyond seeing and sight. This is in a vision, it means a energy, a spirituality. But we should develop the power of anticipation of the coming events, of the coming problems or gains and losses, and be able to develop a strategy to meet those events and should be well prepared. Our past experiences, our past observations, studies, and many times, as I talked, that the energy fields around us, which is called quantum flux. Now, in modern science, as the Einstein has said, that we or plants or any material are not just material bodies. We are all in wave form and interact with each other and over long distances. So these energies they interact, and it is true. I have felt it in my life and experienced it, and these have helped me to know the coming problems, difficulties, or something which has happened. It, this is true, and I have experienced it. And in these visions, you must have a calm mind, meditate, and it will dawn upon you. And but it has to It requires an ingredient. Your mind has to be pure and your purpose has to be honest and pure. So, next is 15th, truthfulness. For a surgeon, truthfulness. What is it? When you are asked a question, you must pause, think, what is the truth, and then speak. Communicate in a simple, understandable language. Or you say some gibberish in some other language, in Sanskrit or high English terminology. You are not telling the truth because the other person is not able to understand, or he just listens and say, okay, understandable language. Speak both sides of the picture. There are pros and cons, possibilities that the patient will survive 100%, or there is a chance that survival chance are 90% and 1% chance of some type of complication, small or big. You must tell honestly, truthfully, and you should quickly correct if you are misinterpreted. I say something, the other person understands something else. So I should tell the person, sorry, please, let me explain you again. And another thing in truthfulness is that you should not, accept the false persons. You should tell a spade a spade. Tell, sir, madam, your actions do not match with what you are saying. So your actions and words are not matching. And in the truthfulness also is important to never associate with people whose standards or integrity you mistrust, right? So this is truthfulness because you associate with people, you in the mind you mistrust their integrity. This is not being true to yourself or their standards. 16th, ability to learn from your own mistakes. Now, it involves owning a mistake, apologizing, and to start working on a solution. 17th, learning agility. Now, what is agility? Is like a mountain goat, very high goats with few vegetations. But the goat finds a grass somewhere and jumps and turns quickly on a very small cliff and stabilizes itself and gets that grass. So, a surgeon has to be agile so that it remains flexible and makes sense of uncertainties like small cliffs and should be able to change the course of action quickly and to achieve the needful. Number 18, being assertive. To be assertive is to be able to stand up for yourself and your associates and protect the belief, truth, and rights of yourself and your associate. Take firm decision and enforce them. To be able to say a firm no, not possible. Sorry, I will not do it. I will not associate with you. This is being assertive because it is very, very important to do no wrong, whatsoever the pressure may be, from any side, any quarter. Say, sorry, no, I will not do it. Number 19, self confidence. You should identify your powers and weaknesses, should be able to handle criticism with grace and understanding. And then, with confidence, you should be able to walk gracefully, shine with knowledge and understanding, fly high with confidence. This is very important because confidence generates confidence in your staff, in your team, in your patients to whom you have to deliver your services and which have to associate with you. Every leader who project confidence, uh, get very good results. Number 20th, ability to talk. So give your ability to talk means give your how will you be able to talk? Talk back. If you're talking means you are either telling someone or you are talking back. first of all, to be able to deliver a good talk, you should be learning a lot, reading a lot, and then you should be able to give your 100% undivided attention to listening, and then have articulate interaction. Let the other person say something completely, and then you speak something. Do not speak while the person is speaking. This is ability to talk. Then the person will listen to you. 21st, networking. It is said that united we stand and divided we fall. So meet and talk to the people who may be helpful to you. Dare to ask what you need. Utilize your experience, abilities, and connection with others. This is very alone, we cannot do much things. We have to mobilize our people and have create a network continuously. And then similar thing, 22nd, resourcefulness. It is mobilizing your all materials and human resources for the need that has arisen at that time. It may sometimes involve bypassing rules for and regulations. For example, if I am a surgeon, I have a serious patient and I do not have facilities to manage that, has come to me, and I have no ambulance. I put him in my car, then I have to jump the red lights. Maybe I have to drive on the wrong side. But it is being utilizing whatsoever resources are available. The road is available, so I have to use that road for the right purpose, for the right goal. But you have to be resourceful to quickly think that in this difficult situation, you can utilize these things. Number 23rd, being tech savvy or technically savvy. We should be knowledgeable and smart with modern technology. You can take small courses on net or practically and incorporate these things into your personal and professional lives, because this is the time of computers, information technology, and so on and so forth. We should be able to incorporate it in our day to day lives, professional and personal. 24th, being inquisitive. We should observe, listen, and read and dive deep to read what is written in between the lines and to find out the hidden secrets and think the unthinkable. And I will say also we should uh, read the same thing again and again. Every time you find a better meaning, more understanding. So, being inquisitive means finding out what is written, what is spoken, what should be, what is the truth. So, this is very, very important for us. 25th, a fair attitude. So, we should not be biased or quickly judgmental. We should think and act out of the loop. What is the loop? Okay. So, this thing is lost. This person was walking from there. He's a thief. No, not like that. He may not be a thief. So we should make for room for others to survive and thrive. We should not start blaming each others or be judgmental about each other without proper and thorough investigation, understanding, wisdom, and knowledge. 26th, problem solving. We are surgeons. People come to us with problem, pain, vomiting, abdomen swelling, this swelling, fever, all these things. We must identify, analyze the problems. Not only these, the problems in administration, the problems in life, in general, all problems which we are daily confronted with. Some problems come from the government, some from the dear relatives, some from the dear friends, some from staff, some from our bosses, some from our wife, some from our husband and children and parents. But we have to identify, analyze it, find the root cause, and then deal with these problems. Do not give up easily. Never give up easily. When the God presents you with a problem, always remember that the God has created the problem and God has created the solution. The solution lies here, right, left, up, down, somewhere. We are in between the universe, our planet is just floating in the space. And the solution to all problems are there. We will find them. Do not give up. Do not give up. Never give up. 27th, think out of box. Some use the same instrument, perform the same procedure, and use the same success strategies in high volume and tone. Present themselves as great achievers. Others follow the universal principle, which is the universal principle. Start, change, stop, then again start, change, stop. These people who follow start, change, stop will discover new instruments, new methodologies, new ways to perform surgeries in a simpler and better way. These people are not ashamed by accepting some of the old procedures which have gone out of fashion and which are being looked down upon, but which are useful, like tissue repair of inguinal hernia, which I do many times with very good results. And tension free with meshes only when there is tension. When the tissue is strong and there is no tension, it can be approximated what is the need to promote the companies with mesh. And for inguinal hernia, what is the need to go the lengthy way? Anyway, there are many people teaching it and saying themselves as great teachers, but how many are following? Because this is unnecessary to go the lengthy way for most of the patients. Some people have special indications, like their posterior wall has completely destroyed the hernia record, and this and that, or they have some other problems, the tissues are weak. So we should think out of box, not only for future, for past. We should not agree with totally with what is going on. We should use this jump out of this box. Do not let your brain be occupied by other people. 28th is reliability. Remember, for a surgeon, just performing very beautiful and good surgical with good surgical hands is not enough. And reliability means keeping commitment, fulfilling promises, being an open book with nothing to hide, having an exemplary behavior, and being punctual. The others will feel that you are reliable. There is one chat. Chandrakant, Sarji, good afternoon. And Melissa, is your father-in-law okay? Yes, he is doing well now, with the grace of God. He is an old man who is staying with me now due to certain circumstances. Thank you very much, Melissa and Chandrakant ji from Himachal, player. So now I come to 29th, integrity. Now, see, these things are not only applicable for surgeon, they can be applicable to any and every profession and personal life of any person. But here I am being a surgeon, I'm talking it for surgeons beyond surgical procedure and beyond surgery. So, integrity, honesty with strong moral principles. This is your personal integrity with strong moral principles. You stand nothing to lose, I tell you, from my own life and experiences if you have strong moral principles. Being good, I always say that what is God? God is one O taken out from good is God. So when the somebody has the good qualities and innumerable good qualities, that person is like God. I mean, incorruptible and ethical. To value your own time and space and not to get involved in rude argument means we should just, if somebody start getting rude, we should not getting rude. This is integrity because we are ourselves. The other person is different. We should not forget that we are doctors, we are surgeons, we have our moral values, not to shout, not to be bad, not to look down upon. We should give the other person because that person is that person. And we should only see him or her shouting and things, but don't yourself start doing it. Uh, Also love watching you operate. Carbuncles are my favorite. Okay, these days in India, Mr. Melissa is giving in the chat. Thank you. But now this is the pandemic area, and Corona time is killing people. The resources have fallen short, and the leaders have not been able to visualize and anticipate and been able to create since long time the required health facilities, which is the health is the first wealth. This is by the way I'm interacting with the live chat. So 30th, physical stamina for a surgeon. Now situations will arise quite often where in spite of discomfort and fatigue, you should be able to sustain activity at hand energetically over a long period of time. It happens many times, especially with anybody in life or any profession. But with surgeons, it happens very often that we are get caught in a situation where we have to forget our discomfort and fatigue and to rather become more energetic over a long period of time. And that is to achieve the desired goal. I remember many, removing tumors with broad bases where the bleeding started. And once the thyroid also, where the bleeding started. And I quickly moved, to go to the inferior thyroid artery and superior thyroid pole and other things. So sometimes it is very vascular. And that tumor, I remember, so I had to quickly mobilize it. And when I mobilized it and found the feeding vessels, and it all became silent. So you have to rather be very having discomfort or fatigue or discouragement. So you should have not only physical stamina, a mental stamina also. 31st, communication skills. Now it requires willingful creation of respectful, friendly environment of mutual confidence and to remain open minded and attentive to both verbal and non-verbal communication. So it's very important. I will repeat it. No, you need to make an environment willingly, create it, which is mutually respectful, friendly, and the person should have confidence on one another that okay they have sat on a table to communicate and to remain open minded and to be very attentive to the verbal and non-verbal language means eye language, body language. And this is the way there are many things you will find on YouTube and books how to understand the eye language or body language. So William Shakespeare, I said that the eyes which are the windows to your mind, that you can see the mind through the window. So like that. 32nd, decision making skills. Now we also always need to make decisions every time, every second, every minute, what to do and what not to do. Again, William Shakespeare, to be or not to be, to do or not to do. Okay, it requires spreading. No, this I have thought all these things over 3 4 days, and then I'm giving this talk. So I thought, how should one make decision? So I thought that it should require how I do it. So it I do it by spreading the objects of decision, what decision about what has to be taken. Then past experience, relevant experiences, my intuitions of future outcome, and possible calculated risks. So it is no risks, no profit. You can't do anything in life unless you are willing to take some calculated risks. So this had to, in the your clear and calm mind, on the table of clear and calm mind, you have to put all these things. What is the object of decision? Your past relevant experiences, your intuitions of future, and your possible calculated risks. And then you have to weigh and decide with a very calm and gentle mind, understanding and managing your own emotions and emotions uh, of associated people. You see, when we have to decide, sometimes we get emotional about it. So we have to understand why this emotion of fear, of anxiety, of anger, of whatever emotion is coming. And then we have to control that emotion, because that will not let us take the right decision. And the team around us who is helping us to make decision, we should also have to understand their emotions, and to maybe even identify their emotions and tell them maybe you are getting emotional about it. Okay, then this is called EQ. There is one is IQ, intelligent quotient. One is EQ. We have been reading IQ since our childhood, but EQ, I will take another talk on this. EQ is a wonderful thing, emotional quotient. So we have to understand it rather than express it in, especially our scriptures, and mainly in Buddhist scriptures. This is elaborated very clearly. Means you should keep your mentality and mind open and clear. And as the elements of anxiety or fear or greed, like some decisions should never be taken by greed. You will take a wrong decision. Fear, anxiety, anger. No, these will not give you. You think angry with someone, go and fight. Oh, why fight? There can be another solution. Why be greedy? What will you gain? Because you have to take from somebody by being greedy. There is no need. I have enough. So, or I can manage by my own hard work. So give some time. So these, identify them. Don't let them occupy your mind. And then 33rd is healing touch. So, in addition to our physical selves, we are all fields of energies which are being shared and which are being felt. Now, healing is also again energy field and spirituality too. So, some gentle, your own gentle presence, loving face, loving eyes, and touch. Very, very often, I have felt that when I touch the hand of a patient, or put a hand on the shoulder or on the head, the patient becomes relaxed. The heart rate on the monitor falls down, the blood pressure comes down, and their anxiety and fear comes down. They are better capable to meet the surgery or post surgical, this improvement, healing. So, this healing touch, both this is passed on, because it passes on the hope, calmness, and confidence to the troubled mind of the patient and their attendants. 34th, to be aware of oneself. So we always try to think what the others are saying, who are others, good and bad, and wrong or right. But most important is to know yourself. It is to understand how you perceive yourself and how others perceive yourself. Like I always say that the people know about you, about me, much more than I know about myself, because they observe me, and I believe that I am good, but people will observe my bad traits. So I will say I'm bad. So people say, no, no, you are good. They will observe my good traits. So this is a balance, that how do you perceive, and you should also think what the people are perceiving. Listen to the criticism. You can benefit from listening and improving by listening to your criticism. It is to align your behavior with your values. You should know your values. Okay, now I should think what should be my values, and then values. It should not be that my birds fly high and my deeds remain low. I should align them, if not on the top, somewhere the middle path, but they must be aligned. 35th and the last one, maintaining influence. This is to promote yourself and your team, maintain a continuous, growing, dynamic network, and a firm, undisputed foundation of trust. And the best ingredient of the influence are these: the undisputed foundation of trust among your staff, your relatives, friends, and your patients, who are your customers too, and whom the God has given you the opportunity to serve them. This the surgeons are blessed, because to them only those people come who find no remedy in prayers, in the quacks, in the medicine, in the easy ways. They have to submit themselves, get admitted, get under anesthesia, get themselves cut and stitched, dressed, and take time in healing. So it's very important. I will tell you an incident about all this lecture. When I was a senior resident surgeon, after my completion of post graduation from Government Medical College, Patiala, I had joined Christian Medical College and Hospital, Ludhiana, and in 1983. So there was a head of the department, a tall American fellow, a F. Eggleston, who had worked worldwide as a as a charity in China, also some other countries also, and went back to US. I think he is no more there, but he used to say a very common quote: "I can train even a sweeper to do any fantastic and big surgery." Unquote. So to be a real surgeon, you need to rise above and just conducting a big surgical procedure. You have to rise beyond surgery. My next talk on the same subject will involve different perspectives, my personal experiences, because there are many other aspects to surgeons beyond surgery, like, for example, financial aspects, their own happiness, their family happiness, their own safety. So many which are never taught in the classes, and even so many in the conferences. People give big lectures and perform big surgeries like laparoscopic, this, that surgeries, which adrenalectomy. Now, adrenalectomy requires highly specialized surgical center, and most of the surgeons say 95 of the surgeons are working in small centers, their own or small hospitals, and we need to train them for the common surgical procedures to be done in the best possible way. We have to train their minds, train their personality. These are nowhere in the conferences. So I hope you will find my talk useful. And if you find it useful, please share it and like my channel. Press the bell button so that I am encouraged to keep on talking. Thank you very much. See you later. Bye bye for now.